and the urethra. During ejaculation, nearly 300 million sperms move from the testes through the tubes called the vas deferens into the area of the prostate. At this point, the prostate contracts, closing off the opening between the bladder and the urethra, releasing fluid into the urethra and pushing semen on through. The seminal forms a thick fluid that is alkaline in order to protect sperm from the acidic environment of the female vagina. The gel is liquefied by enzymes from the prostate gland. It also contains sugars to nourish the sperm. The seminal plasma is left in the vagina. Sperm use their tails to swim through the layers of cervical mucus that guard the entrance to the uterus. During ovulation, this barrier becomes thinner and changes its acidity, creating a friendlier environment for the sperm. On the other side, after releasing the egg, at about day 14 of the period, the egg arrives at a specific portion of the tube called the ampular isthmic junction. It rests for another 30 hours. Fertilization occurs in this portion of the tube. Once the sperm has entered the uterus, contractions propel the sperm upward into the fallopian tubes. To meet the waiting egg, sperm must travel from the vagina to the fallopian tubes, a tough journey that few sperm survive. This process may be nature's way of allowing only the healthiest sperm to fertilize the egg to provide the best chances of having a healthy baby. The first sperm enter the tubes a few minutes after ejaculation. But, however, the first sperm are not likely to fertilize the egg. Motile sperm can survive in the female reproductive tract for up to 5 days. The magic happens in the fallopian tubes. The fallopian tube pushes the egg towards the uterus. Cilia push the sperm towards the egg. Also, the surrounding cells of the egg produce a chemical that attracts sperm. The sperm first burrow through the cells of the corona radiata. Only one sperm can successfully break through this layer, and once it does, the surface of the egg changes immediately to prevent any other sperm from entering. When the sperm enters the egg, the tail is no longer needed and disintegrates. The head of the sperm fuses with the egg. The sperm's nucleus, where the chromosomes are stored, enters the egg cell, looking for the egg's nucleus. Egg combines genetic material with the sperm to create a full set of chromosomal DNA, with 23 pairs of chromosomes that contain a unique copy of half the genes of the parent source. This is the blueprint for a whole new, unique person that instantly determines gender, hair color, eye color, and many other characteristics. The combined sperm and egg is called a zygote. It is the earliest developmental stage. It divides rapidly in the days following fertilization. The zygote then travels down the fallopian tube to the uterus. This journey typically takes about 3 to 5 days. After fertilization, the zygote continues to divide and morph into a blastocyst ball of 16 cells, approximately 5 to 6 days after fertilization. It is smaller than the tip of a ballpoint pen. Once the blastocyst contacts the endometrium, some of its outer layer cells, known as the trophoblast cells, proliferate. Then they lose their cell membranes, merge, and act as a single structure called syncytiotrophoblast. This multinucleate cytoplasmic mass aggressively burrows and digs its way into the endometrium and invades the uterine wall. it also starts to secrete a hormone called HCG. HCG is a pregnancy hormone that is crucial in maintaining the corpus luteum. The corpus luteum produces progesterone and stops the menstrual cycle. HCG helps sustain the corpus luteum until the placenta takes over hormone production. HCG is often used as a marker for pregnancy detection. Pregnancy tests detect the presence of HCG in urine or blood to confirm pregnancy. Elevated levels of HCG during early pregnancy are associated with morning sickness, which includes symptoms such as nausea and vomiting. HCG also helps establish immune tolerance in the mother's body and modulates the immune response to protect the fetus from being recognized as foreign tissue. HCG plays a role in the development of fetal organs and tissues, particularly during the first trimester. Toward the mid of the second week of development, some spaces called lacunae begin to form in the syncytial trophoblast. These spaces fuse together to form a network filled with maternal blood of the damaged endometrium. Finger-like projections called chorionic villi begin to extend like the root of the planet and are surrounded by a pool of maternal blood. Here is where the exchange is happening. Maternal blood, rich in oxygen and nutrients, flows into the intervillous space and diffuses across the placental membranes into the fetal blood. At the same time, waste products and carbon dioxide move from the fetal blood into the maternal blood for elimination, while the blood will never mix. Also, this process anchors the placenta to the uterine wall, ensuring a stable connection. About 4 weeks from the beginning of the last period, near the next period, the blastocyst has begun to produce the pregnancy hormone to tell your ovaries to stop releasing eggs. From then on, the menstrual cycle pauses. The blastocyst is called an embryo now. Home pregnancy test might be able to get a positive result. At week 5, the circulatory system, brain, and spinal cord are beginning to form, and the tiny heart will start to beat. The baby's heart beats about 54 million times before birth. The umbilical cord, which attaches to the fetus, transports nutrients and oxygen to the fetus and removes waste products. The umbilical cord is rich in stem cells that have the ability to differentiate into various types of cells, such as bone cells, fat cells, and are responsible for generating the different types of blood cells. The length of the umbilical cord can vary among individuals, averaging around 55 to 60 centimeters. The nose, mouth, and ears are starting to shape at week 6. At weeks 7 and 8, the embryo has doubled in size since last week's. Little hands and feet start to grow. The placenta is fully formed and functional by the end of the first trimester, around 12 weeks of pregnancy. At week 9 to 12 of pregnancy, the embryo is called a fetus. The baby is almost fully formed and has completed the most critical portions. The facial features are more recognizable. The fetus's head is rotated and bent towards the chest, and he can occasionally touch his face. The diaphragm muscles start to grow. The reproductive, circulatory, and urinary systems are all at an advanced stage of development. The fetus will urinate in the amniotic sac. It is a sign of the proper functioning of the fetus's body. If the baby is a girl, her ovaries contain millions of eggs. If the fetus is a boy, his testicles will already start producing testosterone, male sex hormone, which is necessary for the development of his reproductive system. She or he is about 5 centimeters in size and 14 grams in weight. She or he is growing and maturing until ready to birth. During the last weeks of pregnancy, the baby will continue to gain weight and accumulate more body fat. As the baby grows larger, the uterus expands, and the mother may experience increased discomfort, especially in the lower back, pelvis, and abdomen. In preparation for birth, the baby may experience position changes, such as shifting from side to side or rotating within the womb. Most babies settle into a head-down position in the mother's pelvis, with their head closer to the birth canal. This relieves pressure on the diaphragm and makes breathing easier for the mother. It may also increase pressure on the bladder, leading to more frequent urination. This position, known as cephalic presentation, is considered ideal for vaginal delivery. However, some babies may remain in a breech or feet-first position. Throughout the final weeks of pregnancy, the baby's lungs continue to mature and produce a substance that helps keep the air sacs open and facilitates efficient oxygen exchange after birth. The baby may engage in practice breathing movements in the last weeks. These movements involve rhythmic contractions of the diaphragm and chest muscles, aiding in lung development and preparation for breathing air after birth. In anticipation of labor and impending parenthood, the mother can bring about a range of emotions. She may feel excited, anxious, nervous, or a combination of these emotions. Many mothers experience a surge of energy and a strong desire to prepare for the baby's arrival. This is commonly referred to as the nesting instinct. She may have an intense urge to clean, organize, and set up for the baby. Braxton Hicks contractions can occur as early as the second trimester, but become more noticeable in the last weeks of pregnancy. They are often described as practice contractions and help prepare the uterus for labor. As labor approaches, true labor contraction occurs. True labor contractions have a regular pattern and become increasingly frequent, longer, and more intense over time. They lead to gradual dilation of the cervix. The amniotic sac rupture, or water breaking, can occur at different times during labor. It may rupture on its own without any intervention. Or if the amniotic sac hasn't ruptured naturally, the healthcare provider may intentionally rupture the amniotic sac using a sterile instrument called an amniotomy hook. During childbirth, the relaxin hormone in the body helps soften and loosen the ligaments and tissues in the pelvic area. This allows the vaginal walls and perineum, the space between the vagina and anus, to become more flexible and stretchy. Then the cervix begins to change in preparation for delivery. It starts to soften, thin out, and dilate. The cervix gradually opens, dilates, to allow the baby to pass through. It is typically measured in centimeters, with 10 centimeters indicating full dilation and readiness for pushing. During labor, the placenta reserves oxygen and nutrient to ensure that the baby receives sufficient oxygen and nutrients even during the temporary reduction in blood flow caused by uterine contractions. As the uterus contracts during labor, the placenta begins to detach from the uterine wall. This detachment is a natural process that allows for separating the placenta from the uterus tissues after the baby is born. Once the cervix is fully dilated, the mother enters the pushing stage. She actively pushes during contractions to help move the baby down the birth canal. As the baby's head moves through the birth canal, the vaginal walls stretch to accommodate its size. The vaginal tissues are designed to be elastic, allowing for significant stretching without causing permanent damage. Sometimes, a healthcare provider may perform an episiotomy to facilitate the baby's birth and prevent severe tearing. This is a surgical cut in the perineum to enlarge the vaginal opening. However, episiotomies are not routine and are typically only done when necessary. During the pushing stage, the baby's head emerges first. Followed by the rest of the body. The baby's shoulders rotate to align with the pelvic outlet, allowing a smooth passage through the birth canal. After being born, the baby's respiratory system undergoes significant changes as the baby transitions from receiving oxygen through the placenta to breathing air independently. The umbilical cord is clamped and cut, separating the baby from the placenta. This is usually done once the cord has stopped pulsating to ensure the baby receives the maximum amount of blood and nutrients from the placenta. The healthcare provider evaluates the baby's condition, including vital signs, weight, and overall well-being. After the baby is delivered, the uterus continues to contract to expel the placenta. These contractions, often called afterbirth contractions, help detach the placenta entirely from the uterine wall and push it out through the birth canal. The doctor may gently assist in the delivery of the placenta by applying controlled traction on the umbilical cord or by applying pressure on the mother's abdomen. The process of placental delivery may take a few minutes to up to an hour. The doctor monitors this process to ensure that the placenta is delivered entirely and that there is no risk of retained placental tissue, which can cause complications if left behind. The doctor also examines the placenta maternal side for abnormalities. On average, a placenta typically weighs between 500 to 600 grams. The mother and baby are encouraged to have skin-to-skin contact and begin bonding. Immediately after delivery, the uterus begins a process called involution. Hormonal signals, particularly the release of oxytocin, help the uterus to contract, reducing its size. This process helps expel any remaining placental tissue and promotes healing of the uterine lining. Vaginal discharge, called lochia, consists of blood, mucus, and uterine tissue shed as the uterus heals. The discharge is bright red and heavy, similar to a heavy menstrual period. This discharge typically lasts for several weeks and gradually changes in color and consistency as the body heals. Transitions to a pinkish or yellowish color. The breasts also change to support breastfeeding. The breasts may become engorged as milk production increases, causing them to feel swollen, tender, and firm. As the mother expresses milk, the engorgement typically resolves and the breasts adjust to the baby's feeding needs. The act of breastfeeding promotes a special bond between mother and baby. This bonding experience can release hormones like oxytocin and endorphins, contributing to relaxation, happiness, and reduced stress. Oxytocin also promotes uterine contractions, helping the uterus to return to its pre-pregnancy size. After childbirth, the mother needs to rest to recover. Childbirth and the postpartum period can bring a range of emotions for both the mother and the father or partner. It's crucial to provide emotional support and understanding. When a woman becomes pregnant, her body undergoes hormonal changes, primarily influenced by two hormones, estrogen and progesterone. These hormonal shifts prepare the breasts for milk production. Shortly before childbirth, another hormone called prolactin, which is responsible for milk production, increases in the woman's body. After delivery, when the baby begins to suckle at the breast, it stimulates the nerves in the nipple and areola, sending signals to the brain. Within the breasts, there are small clusters of granular tissues called alveoli. These alveoli are responsible for producing milk. During pregnancy, under the influence of hormonal changes, these alveoli begin to multiply and enlarge. By the time the baby is born, the mother's breasts have around 150,000 alveoli in each breast. This is many times more than the number of alveoli that a non-pregnant woman has. Inside each alveolus, there are specialized cells called secretory cells or alveolar cells. These cells are the key players in milk production. They produce and secrete milk components such as proteins, fats, lactose, and immune factors. In response to the baby's sucking and nipple stimulation, the hormone oxytocin is released from the pituitary gland in the brain. Oxytocin triggers the letdown reflex, also known as the milk ejection reflex. This reflex causes the muscles around the alveoli to contract, pushing the milk into the milk ducts. And out through the nipple. Breast milk production operates on a supply and demand basis. The more frequently and effectively the baby nurses, the more milk is produced. When the baby empties the breast during feeding, it signals to the body to produce more milk to meet the baby's needs. In the initial days after childbirth, the breasts produce a thick yellowish fluid called colostrum. Colostrum is highly concentrated and contains antibodies and other immune factors to provide the baby with essential protection. After a few days, colostrum transitions into mature milk, which is thinner and lighter in color, but contains a perfect balance of nutrients, including proteins, fats, carbohydrates, vitamins, and minerals, specifically tailored to meet the nutritional needs of a growing baby. It also contains antibodies and other immune factors that help protect the baby from infections and diseases. Breastfeeding has many advantages for the baby's health and development. It helps strengthen the baby's immune system, reducing the risk of respiratory infections, ear infections, allergies, and other illnesses. Breast milk is easily digested, leading to less constipation and diarrhea. It is also associated with a reduced risk of obesity, diabetes, and certain childhood cancers. Breastfeeding provides several benefits for the mother as well. It helps the uterus contract and return to its pre-pregnancy size faster. Breastfeeding can also aid in postpartum weight loss as it burns extra calories. Additionally, breastfeeding has been linked to a lower risk of breast and ovarian cancer. The composition of breast milk can vary from woman to woman and can change throughout the course of breastfeeding. The levels of various components can be influenced by factors such as the mother's diet, health, and environmental factors. Breastfeeding promotes bonding between the mother and the baby. Physical, skin-to-skin, and eye contact during breastfeeding help strengthen the emotional connection between the two. For the first 6 months of life, the World Health Organization, WHO, recommends exclusive breastfeeding, meaning the baby receives only breast milk and no other foods or liquids, including water. At around 6 months of age, infants begin to eat solid foods in addition to breast milk. Breastfeeding continues alongside the introduction of solids, gradually decreasing in frequency as the baby eats more solid foods. Breast-stopping milk production, or breast weaning, is highly individual, and there is no fixed age at which breastfeeding must end. This can happen gradually and naturally when a mother and baby are ready to stop breastfeeding. The key driver for milk production is demand. When a baby breastfeeds less frequently, the breast receive fewer signals to produce milk, leading to a gradual decrease in milk supply. Mother's body reabsorbs the milk that is already present in the mammary glands. The breast tissue gradually shrinks. This can result in a reduction in breast size over time. Some women may experience a smooth transition with minimal discomfort, while others may have more noticeable changes in breast size or experience mild discomfort as their bodies adapt. Wearing a supportive bra and cold compresses can help alleviate discomfort during the weaning process. In females, significant hormonal fluctuations occur during pregnancy and after childbirth. The birth process can result in physical changes in the body, such as vaginal stretching. It can lead to discomfort or pain during sexual activity. The demands of caring for and nurturing a newborn, combined with the physical recovery from childbirth and adjustment to a new routine, can leave little energy or desire for sexual activity. The emotional changes that come with becoming a parent can also impact libido. Some individuals may experience changes in their body image after childbirth, which can affect their self-esteem and confidence in sexual situations. Caring for a newborn is a shared responsibility that both parents should be involved in. Sharing responsibilities can alleviate the physical and emotional strain on the mother and foster a stronger bond between both parents and the baby.